Good afternoon, everyone. I'm Jennifer. It's great to be here. Thank you so much for the opportunity. Thanks for being here, and thanks to the NCCEH the opportunity to give this webinar today on public health communication competencies to support workforce transformation. The University of Guelph resides on the treaty lands and territory of the Mississaugas of the Credit. We recognize this gathering place where we work and learn is home to many past, present, and future First Nations, Inuit, and Métis peoples. Our acknowledgement of the land is our declaration of our collective responsibility to this place and its people's histories, rights, and presence. Here's our quick overview for our webinar today. We'd like to begin by getting to know you, our audience. So in a moment, we have a few Slido questions for you. We already had a very kind introduction to each of us, so thank you very much for that. We'll give an overview of our project on public health communication competencies, the modernization of the core competencies, our project specifically, and the competency framework it has resulted in. We'll also touch upon the connections between our competency and CIHR discipline-specific competencies. And we'll go over a number of case studies that provide examples of the use of communication and communication competencies within environmental public health practice. So if I could direct you to please join us at slido.com with the following code number. There's a few questions there that will help us to get to know you and who is with us today. Our first question is, in which province or territory do you work? I'll just give you a moment to complete that. Our next question is, which best describes the organization that you work for? And what best describes your role in public health? Great, thank you. That was really helpful. So I'm Jennifer, as was mentioned at the outset, and I have the pleasure and privilege of directing this project as the principal investigator. I have an awesome team, Dr. Melissa MacKay, who's mentioned, and Devon McAlpine, who's also here today. Behind the scenes, we also have Ignor Sidhu, who's an MPH practicum student, also in our department. And this research is being conducted in collaboration with Doctors Andrew Papadopoulos and Lauren Grant as well. The purpose of this project has been to build consensus on a modernized and strengthened set of communication competencies for public health in Canada. This research has been funded by a CIHR Catalyst grant that ties to the Chief Public Health Officer's 2021 report. And just so we're all on the same page, competencies are the values, knowledge, and skills and behaviors needed to effectively perform on the job in public health. And for the context of our project specifically, when we consider communication, we're considering it to be very broadly defined across its many forms, purposes, and audiences. So this might be to communicate to the public, to colleagues, it could be written, oral, or visual communication, online or print, and so on. We wanted to provide a little bit of context for this project before we dive into the details. So competency development has been a growing area in public health, and it's gaining a lot of traction, especially in the last few years. Competency development is occurring in an environment of public health system transformation, and this has in part been driven due to the challenges that public health has faced during the COVID-19 pandemic. As you probably know, the Public Health Agency of Canada commissioned the National Collaborating Centres for Public Health to release a renewed core competency set for public health in 2024, revamping the 2008 version. A lot has happened in public health since then, so this is really important work. In addition to that renewal of the 2008 core competencies for public health, there are a number of research groups across the country, including ours, engaged in building competency statements and frameworks related to more specific areas of need, including public health leadership, digital public health, Black health, and our project on communication for public health. These additional sets of more specific competencies are intended to complement the core competencies, providing guidance and a foundation for transformation in these more specific areas. Our project progress is laid out on this slide. As you can see, there's 8 steps listed here today. We won't go into the details of all of them. Our focus today is to share with you the competency framework that these steps have led to. I will go over these briefly just now with this slide, though. As I said earlier, the purpose of this research is to build a set of communication competencies for public health to inform public health education practice, and workforce development, specifically in the context of communication, which we know is essential for effective public health practice. Steps 1 through 4 have been completed and have resulted in 5 papers published or in press. We've conducted a couple of scoping reviews about how competency statements are developed. We've done a number of environmental scans about public health education and professional development opportunities related to health communication. We reviewed about a dozen health communication textbooks, and we used these first 3 steps to create a draft list of competency statements. In step 4, our public health workforce survey, we heard from over 350 public health professionals. In that survey, we heard from you loud and clear that communication is an important part of what you do. We saw high agreement with that early set of draft communication competencies for public health that we developed from steps 1 to 3. And we noted your suggestions for additional or missing communication competencies. And finally, we saw that there was a strong demand for future public health training opportunities related to communication. Steps 5 to 7 are also complete now. We conducted key informant interviews, and our Delphi and consensus building process, steps 6 through 8, is mostly complete, with our final Delphi survey due to be completed in the next couple of weeks. We currently have 18 communication competencies statements that comprise our framework, and this is what we're here to present to you today. Some of these statements will apply broadly to all public health professionals. Others will be more relevant to individuals or teams whose public health efforts are very communication focused or specific. We'll share a link in the chat where you can view a PDF of this draft list of statements, and stay up to date with the project as we near our formal launch with the final list of public health communication competency statements. As I mentioned, the 2008 FAC core competencies are undergoing renewal right now, and we wanted to point out a few key changes, or differences rather, between that list and what we're presenting here today. The obvious one is that our list is communication focused and specific. We also aimed to ensure that values and attitudes were embedded in each of the competency statements as necessary, rather than only appearing in a preamble. You'll see that our statements for communication competencies in public health are audience-centered, equity-driven, and culturally responsive. You'll also see nods to using current and emerging technology and addressing myths and disinformation. We'll explore these in more detail on the following slides.
Thank you for that, Jennifer. I'm just going to direct everyone's attention to the link that was just previously shared in the chat there. And that's the PDF of our draft competencies that Jennifer was referencing. So here we have a visual overview, in addition to the PDF, of our competency framework. As Jennifer said, there are 18 competency statements. They're divided into 4 different domains or categories. The framework is intended to be for individual public health practitioners with communication-focused roles. So these 18 competency statements are underpinned by the foundational statements, which apply to the entire framework and all public health communication practice. And then we have competency statements for how-tos, interventions, and communication outcomes that aim to address all aspects of public health communication. The competency statements range from essential theories and attitudes to skill sets for precise communication, communication processes, competencies such as evaluating public health communication initiatives, and communication for achieving public health goals and objectives, things like influencing government or creating behavior change in population health. Next slide, please. So how do we anticipate that you might use this framework? As Jennifer said, there's lots of frameworks for public health and lots of competency statements for you to reference. Our modernized framework serves as a companion document to other frameworks and is intended to be used in unison where appropriate. So specific to this audience with environmental public health, other relevant frameworks would include the core competencies for public health in Canada, which will hopefully be renewed by the end of the year, and the Canadian Institute of Public Health Inspectors discipline-specific competencies. Our framework will provide an enhanced and comprehensive communication competency overview, which other frameworks will not have the opportunity to get into in detail. Speaking of the CIHR competencies, there are many synergies between them and our framework. Both place communication on the foundation of public health science and emphasize the importance of active listening while communicating with audiences. Furthermore, both of the frameworks highlight the need to tailor communication based on situational and audience needs, as well as audience characteristics, things such as age, gender, culture, and education. Building on these synergies, our framework builds a more comprehensive and modernized assessment of public health communication. That focuses on the use of tech, addresses modern challenges to communication, things such as mis and disinformation around environmental public health. Our framework integrates values associated with social determinants of health, social justice, and integrating and applying evidence from different disciplines to address individual, community, and population health. So why are we prioritizing communication competencies here? Regarding today's topic, applying communication competencies to environmental public health, a 2018 study by our colleagues at the University of Guelph found that environmental public health professionals broadly ranked communication as the most important competency domain for their practice. And this was amongst both management and frontline employees, where managers are tasked with communicating with their staff, other public health employees and agencies, as well as maybe the media. Frontline workers are tasked with communicating with the public. Both of these communication environments present unique tasks and challenges, and communication competencies can provide guidance in both of these domains. So now we'd like to turn the focus back to you and ask what you think a communication challenge might be in environmental public health. If you could try to keep your answers short and concise, that would be ideal. And we'd love to hear what challenges you may have faced in your roles. Explaining complex health concepts succinctly, definitely a challenge in the environmental health space. Similar comment about complex concepts. Providing education to the public, risk communication, duplication of communication, translation, and practical knowledge. So these are all fantastic examples of challenges that we face across the field, as well as specifically in environmental public health. And we quite strongly believe that our competency framework addresses most, if not all of these in some capacity. We'll leave the poll running for just a moment longer. And we'll move on to some case studies. Thank you.
Okay, so now we are going to explore some environmental public health roles and responsibilities and how the 18 communication competencies can support effectively performing within these roles. So, as you know, food safety and communication are important in numerous points in the food system. Inspectors must communicate effectively with owners and operators of facilities that make and serve food, complete inspection reports during routine inspections, and then communicate the results with diverse audiences. Inspectors must also analyze surveillance data and then communicate with those at risk of foodborne illness outbreaks. And then finally, inspectors also respond to inquiries about food safety from the public, which includes those with a range of communication needs and wants. So the communication competencies most related to food safety inspections include using an audience-centered approach, using active listening, mobilizing evidence and expertise from diverse ways of knowing, and communicating in a culturally responsive way. So specific to food safety inspections, what communication challenges have you faced? Language barriers. Okay, language barriers ×3. English as a second language, lower literacy, lack of understanding, frustration from business owners, a variety of education levels. Wow, so literacy and language are absolutely a shared challenge across those of you who have completed food safety inspections. And then again, as we heard in the last poll, scientific terms like sensitivity and specificity, which are really difficult to explain and understand. And then, when you layer that with different literacy issues or English as a second language, it's really difficult. And then, mistrust in government post-COVID. So moving on, so the federal government's Environmental Public Health Services team works with First Nation communities to identify and prevent environmental public health risks. And these risks can negatively impact people's health in both the natural and built environments. And although this example is specific to an officer's role within the federal government, This situation and related competencies also apply to other Indigenous populations, as well as equity-deserving populations. So officers work to develop trusting and collaborative relationships with many different groups, including elders and local leadership, business owners, First Nation organizations and agencies, as well as government. And officers work to identify health risks by conducting inspections and providing guidance and advice, and then delivering public health education and awareness, including training. And so there's lots of competencies that are relevant to this case study, and also working with equity-deserving populations, including really grounding our efforts in public health sciences and justice, equity, and ethical practice, using an audience-centered approach, including active listening, co-production, and community engagement, developing trustworthy health messages through tailoring the information to diverse audience needs and wants, being culturally responsible, and ensuring credible messengers, and then communicating in a culturally responsive way that's informed by the relationship between culture, language, and health. And then finally, using communication to shape and influence government to really bring the needs of equity-deserving communities to the fore. So for those of you who have worked with equity-deserving populations, what communication challenges have you found with environmental health? So lack of access to the internet and technology. Regulations don't bend easily to support different needs. Public opinion is contrary to what the evidence supports. Not being able to convince them against their own cultural understandings. Less ability to act on advice when they are alerted about a concern. Distrust of government. Technology issues. Lack of trust in the health system. Yeah, I think trust is a big one because of current and historical harms. And then, yeah, this is an excellent point. The environmental health may not be the biggest priority when there are other issues that equity-deserving populations are facing. Thank you so much. So frontline workers are also available to help the public interpret results of tests for various hazards, like lead in the water, radon in homes, and well water tests, as well as, from things like possible tick exposures. So environmental public health professionals, including inspectors, need to be able to develop rapport to create trust with the individual, understand and interpret the results of the test or exposure, communicate with diverse audiences, including those with lower health literacy and maybe English as a second language, which, as you know, impacts our ability to understand complex health and scientific information. And then we need to be able to tailor the information to the context, the audience, the supports that are available or resources that are available, and even the distress level that the individual has over the tests or exposure. And then use two-way communication to really ensure understanding and allow for questions to really, hone in on that understanding. So the communication competencies relevant to this case include fostering attitudes like empathy, respect, and compassion, and using inclusive communication. Health literacy and the literacy of audiences obviously must be reflected in communication. Knowledge synthesis and research skills are applied to understanding and interpreting the results of tests and exposures. And then finally, being mindful of unintended consequences of communication, like increasing the distress of an individual or someone not understanding the steps needed to protect their health. So for those of you who, do interpret results of these types of tests and exposures, what communication challenges have you faced? Explaining limitations of tests. Yeah, I could imagine that would be very difficult. See that many others are typing, so I'm just giving everybody a second. Determining if clients need to be excluded from high-risk jobs like food handling. Excuse me, lack of scientific understanding. Oh my gosh, I'm sorry. Risk communication. And then, drawing the significance to health.
So just move on to a more broadly applicable case study for all of public health, but especially environmental public health practitioners. That is the climate change response and leadership that's required within public health. So as we're all very well aware at this point, as climate leadership becomes increasingly a public health priority and health vulnerabilities become more evident, effective communication surrounding climate change has also become critical. Specifically at the management level, where we see communication competence directly impacting practice while applying to where we see communication competence directly impacting our ability to apply for climate-related grants, our ability to interpret and translate climate evidence, and our ability to apply climate and health planning tools. Further, it falls on public health professionals to stay current with communication and technology best practices while communicating climate and extreme weather-related health alerts to vulnerable populations. This is something we've seen extensively in the past 2 summers as public health alerts related to extreme weather and forest fires have become extremely common and necessary. Given the societal impacts of climate change, climate-related public health objectives will also require effective collaboration and facilitation of communication with partners both internal and external to health professions. So with both government and community partners, with healthcare and public health partners, and with many others within the communities. The related communication competencies from our framework include applying knowledge synthesis and research skills to climate change and health issues, using current and emerging technologies such as AI to monitor the information needs of the public, and creating climate change and health plans with clear and measurable goals and objectives. Finally, we see fostering partnerships across the community and government organizations as a critical communication competency in this area. Turning it back to you, we'd love to hear what communication challenges you have faced in the area of climate change and related environmental health. Disbelievers, so misinformation and disinformation, lack of trust in the information being received. Definitely a big problem with anything climate related that's become politicized. Absolute unbelief of the facts, so along that same thread, and denialism, a common theme here. And lack of the basic understanding about climate processes, so being able to educate and communicate those basic foundational elements. Lack of trust, and inconsistent internal messages to keep up with. And then some specific examples of communicating risks, such as forest fire smoke to the public. So we've got some very common threads here surrounding trust and misinformation, disinformation, and disbelief of health communication. Thank you very much to everyone that provided an answer. We'll just move on to our final case study of today, which is public and environmental health and safety professionals, kind of broadly speaking. So as you know, public and environmental health and safety professionals review, evaluate, and monitor public health and environmental safety hazards, and they develop strategies to prevent, control, and eliminate disease and environmental impacts caused by biological and chemical factors. So this involves consultation, delivering training programs to employers, employees, and the general public, and communicating these matters to the public relating to public and environmental health, workplace safety, and environmental protection. So many of the competencies from our framework apply to this situation, including the use of appropriate communication theories and best practices when communicating these complex information to the general public, using communication to inform health and safety related behaviors, so really driving that behavior change with our communication, and evaluating communication initiatives. Finally, we also see the use of effective modes of communication, and this may include things like storytelling, engaging presentations, and public speaking, especially in that training and behavior change element where engaging information is important. And for our final Slido of the day, we'd just like to get your feedback on some challenges faced in this area of environmental health and safety. We greatly appreciate all of the active engagement today and the fantastic answers. Sensing that we may have exhausted our Slido capacity for today, we'll move on to supporting the workforce transformation. Oh, I apologize, there were a couple answers coming in there. I'll quickly read over them. So different levels of background understanding and different goals or motivations are a challenge. Lack of time, so being efficient in your communication, and convincing and understanding and perspectives. So really being able to inform audiences with different literacy and reading levels as well, and language barriers, and tailoring audience appropriate. Fantastic. Thank you very much, everyone. So hopefully at this point, we've convinced you of the relevance of these competencies to your work with environmental public health and to public health as a whole. The next step as we develop our final version of this framework and release it in the coming months is, of course, going to be implementation. And we strongly believe that implementation of this framework and competencies in general will rely heavily on collaborative professional development between agencies, governments, and academia. And on this note, through an environmental scan and content analysis, we've identified that there's very limited opportunities currently available in Canada for professional development in health communication. The few opportunities that do exist rarely cover all of the competencies and are often outdated, so especially do not cover some of these newer concepts that we've included in our modernized framework. Similarly, in a survey of the Canadian public health workforce, 85% of the professionals sampled reported that there are inadequate training opportunities for health communication. Surprisingly, nearly 30% of professionals had no previous training, and that includes both informal or formal training in communication. Notably, though, over 80% of the workforce that was sampled was interested in things like webinars and online micro-credentialing, among other training opportunities in health communication. As we look forward towards implementation and professional development, the National Collaborating Centre for Environmental Health, who's graciously hosting us today, may be particularly well suited to participate in production, coordination, and collaboration of these professional development opportunities, especially given the regulatory professional development requirements for public health inspectors. And I'll pass it off to Jennifer to wrap up our presentation. Thank you.
Thanks, Devon. So to conclude, our framework of 18 communication competency statements will be finalized in the following weeks and released publicly in the coming months. We've put a link in the chat if you would like to stay up to date about the project. And our framework will be circulated through the NCCEH and other organizations as well as soon as it is finalized. As Devon said, our framework will be used to help with workforce transformation. More specifically, it could be used for self-assessment of communication competence, to drive evidence-informed education and professional development opportunities, and for organizational team building as well. Thank you so much for your time and attention, and thank you to Melissa and Devon for your participation today, and for all of you for participating in the Slido so well. Thanks so much, and we'd be happy to take your questions if you have them.